Hello everyone. Today I'm going to share some knowledge with you about treating high blood pressure. High blood pressure is a very common symptom, and often the doctor will prescribe you some drugs, and some people respond for the drugs very well, so they can lower their blood pressure easily. And some of them, they not responsible for the drugs, and or even they take 2 or 3 different kind of pills, but their blood pressure still high. So for this kind of situation, so I have found some reason which is cause the high blood pressure, and some drugs cannot sort it out, which is our vertebral arteries, and supplies the brain center, which is the brain stem, and being pressed and being compressed. So I will explain you why we have this kind of high blood pressure, and then if we simply remove the blockage or remove the pressure, and then the blood pressure can be normal. Okay? So blood pressure, because there are so many reasons. One reason which is like stress and high pressure work and long hours working, and this is one reason. Another reason which is our blood vessel getting old and also getting hardening, and some of them because they have the overweight or cholesterol level too high, and smoking and drinking all can cause the blood pressure high, or blood vessel too hard, doesn't want the extend to enough for the blood pressure become normal. But another very important reason, which is our brain, this part of the brain, that's the brain stem, which is the center of our life, and it can balance the blood pressure normally. And if it's healthy, when we have high blood pressure, they will generate some hormone or generate some relaxation hormone to relax or reduce the amount of your blood and widely open the blood vessel in our whole body to allow the blood pressure balance to be normal. So why this center not working properly? One reason, because the arteries, these vertebral arteries, when they supply this brainstem circulation and being pressed by the vertebra or your scalp here. Okay, so let we closely have a look. So because the vertebral arteries, they go through the tunnel, which is side of your neck vertebra, normally from 6 to 1. And until 1, there is a big curve, and to the side, which is goes through this the first vertebra, neck vertebra, and then go under the joint, which is near the occipital bone and the first vertebra, which is atlas. All right, atlas joint, occipital and atlas joint. This joint normally move like this, and then the second, which is atlas and axis joint, which is here. All right, this joint have a big area, okay, big area, which is like half of the thumb size, but the joint is very flat, very flat. The movement of this joint is turning left and turn right. When they can turn left and turn right, and our neck can go up down, this blood vessel will be widely opened. Unfortunately, so this joint often being tied up, because one thing is this joint is a flat joint, and also there's no disc in the front. No disc in the front, not like other vertebrae, they have a disc in the front. So they can support, make the joint open more, then they can move more. When they move more, these arteries can get exercised, alright, and then they will widely open to supply the brain center, which is brain stem, the good circulation, control the life, which is heartbeat, blood pressure, temperature, immune system, and digestion, all the linked with our life, which is supplied the nutrition from these vertebral arteries. Okay? So why our joint and occipital bone and Achilles joint, which is here, okay, can be jammed or pressed, or some of them even fused together, and then affect our vertebral arteries movement, and also give the pressure to the vertebral arteries, not allow them to widely open to the brain to supply enough blood to the brain. Okay, so one thing, because our head is like over 4 kilos or less than 1 stone pressure, this pressure constantly or sometimes with accident, alright, the head is hit by something or by yourself, or whiplash shock. So this joint will be not like this, will be shocked. And also this second vertebral and the first vertebral, which is Atlas and the axis joint, which is here, they can easily be shocked, right? When they shocked, they will be jammed together, not move, and with the pressure on the head is like less 1 kilo, and then it will slowly fuse together. When they fuse together, we cannot move the head widely, alright? We will not move the head widely, and then these arteries will be blocked. Okay, so often they have high blood pressure people, they have a very stiff neck, alright? They cannot move like this freely, or turn left, turn right, and looking up, looking down freely, alright? So, for this reason, we can give the advice, which is, or you can have treatment with me, which is lift the head up and extend this ligament behind the head and the vertebra on this vertebra. Okay, this is a long ligament from here, and make it loose and make the muscle around it loose as well. All right, so we can squeeze and push, squeeze and push slowly and gently to allow the head and the vertebra have a good movement, and also there's a space. This space will regain the space when you move. All right, don't let it jam like this or like this. This will not just affect your arteries, also affect the nerves first, can cause headache or other things. We will talk it later, alright? So that's the main treatment. Lift this up, and move all the vertebrae, and let they be able to move freely, nicely, and then allow the arteries on the side and under the joint go to the brain easily, to supply your brain center, which is our brain stem, a good circulation. Then they will have the good function to balance your blood pressure, make the blood pressure not high, not low, or comfortably, to make your life easier. Okay, thank you for watching this video. So hope everybody can find this space and can find the movement and regain their health. Thank you. Okay, bye.